Fellow Guyanese, I am Dr. Karen Gordon Boyle, and I wish to thank you for joining me on today's COVID-19 update. Now for the global statistics. According to the World Health Organization, the total number of cases is 11,327,790, with 532,340 deaths. In the region of the Americas, the number of cases is 5,820,840, with 265,024 deaths. I will now bring you the update for the situation in Guyana. As of July 7, 2020, of the 37 tests done, there have been 7 new cases coming from Mabaruma Subdistrict of Region 1, bringing our total number of positive cases to 284. 125 persons have recovered, but our COVID-19 deaths have now climbed to 16. In institutional isolation, we currently have 143 active cases, 19 persons in institutional quarantine, and 11 persons in the COVID ICU. To date, we have tested 2,926 persons, with 2,642 being negative. Fellow Guyanese, the number of positive cases continues to be a source of grave concern for the Ministry of Public Health. Over the past week, we have recorded another 25 new cases distributed in regions 1, 3, 4, and 7, with 4 COVID-related deaths. I shared with you last week the traumatic experience of a COVID-19 patient, as well as the unpredictable future of persons who have thankfully recovered but may be subject to medical conditions of kidney failure, lung damage, paralysis, among others, that they did not have before contracting the coronavirus disease. Are we really serious about returning to normalcy when we openly flout all the guidelines that have been outlined for our protection? Are we saying that we are uncaring about our life and those of others around us? Where has our appreciation for life disappeared to? It is unfair to our healthcare workers, 10 of whom have become ill and have had to battle for their lives with COVID-19. And you know what this was totally unnecessary, but for your carelessness. I am pleading with you again to consider your actions and envisage that your life could drastically change and end in fatality. Avoid the COVID-19 trauma and cooperate fully with all who are working collaboratively with the Ministry of Public Health to contain the spread of this fatal disease in all our communities. I wish to refer to the unfortunate situation that occurred with the passing of our latest COVID-19 victim, whereby the information was aired on radio before the health officials were even able to notify the family. I implore members of the media to be sensitive to the fact that when there is a death, the family experiences pain and loss, and that such information needs to come from health officials who can impart the news to the family in an empathetic and caring manner. Imagine the shock of you turning on the radio or TV only to hear for the first time of your mom's demise from COVID-19, and no one is there to support you in dealing with it. Additionally, confidentiality is still the imperative when dealing with medical matters, and this includes a diagnosis of COVID-19. As such, we do not expect to have patients' names and addresses divulged to the public. I also wish to remind our repatriating nationals of their agreement prior to their departure from overseas concerning their 7-day period of quarantine. Repatriating nationals need to remember that even though their PCR test results may be negative prior to their departure, they still have to cooperate with the health officials and provide accurate information on their arrival in Guyana. Our surveillance unit is tasked with following up on every single repatriate, checking in daily by phone for early detection of signs and symptoms of the disease. This requires, among other things, the daily checking of body temperatures, and hence, all repatriates are required to bring thermometers with them. Kindly support our effort by reminding your family members to come armed with a thermometer. Fellow Guyanese, I wish to allude to the irresponsible actions by our citizens in Region 9, whose intent was to transport Brazilian nationals to Georgetown, ignorant of their COVID status and cognizant that the COVID-19 situation in Brazil is out of control. In fact, as of today, Brazil has 1.63 million confirmed cases and 65,631 deaths. Friends, this is just across our closed border. I ask these questions. Is money all that matters? What about your life? Didn't you think of the domino effect that such an action could have on yourself, family, friends? What about the Brazilians gallivanting in the capital? Need I remind you that we need to be wary of all that's happening around us? Our cases are climbing, and so are our deaths. Natalie, our COVID survivor, touched death and stated how very lucky she was to be alive and to be given a second chance. My fellow Guyanese, we may not be given that second chance. And remember, your carelessness could unnecessarily put our healthcare workers' lives at risk. Do your part. Respect the curfew. Wear a mask. Practice physical distancing. Wash your hands frequently and only venture out if absolutely necessary. Stay home, stay safe, and thank you.